I'm Hema. Welcome to Date with CSA. As you all know, I'm the founder of CSA Smart Group and also founder of Royal Amour, where we help needy women and poor students to lead a financially independent life by making handmade jewelry. Today, in the Date of CSA, what we are going to look into, like, if some patients come with losing somebody or from very bad event like recent bereavement or being raped, it is very difficult scenario, isn't it? We will be wondering like how we have to respond to them. And if you're not prepared for this very sensitive issue, we'll be in a very awkward position. We don't know what to say or how to show our support to them. You might think, is there any right or wrong thing to say when we come across patients like that? The first and foremost is to show lots and lots of empathy. Empathy means like we don't need to say like I can understand how you feel. It is something like we putting ourselves in their shoes and acknowledge how difficult the situation is it for them. As I said, there is a right or wrong way. Let's go through the wrong way first, because sometimes we will say like, if anybody come with recent miscarriage, we might say like, you're wrong, you can have another soon. I have come across those situations when I did my obs and gynae. It is very difficult. Some might say like it was just God's will, or some might say like at least you have got other kids. And some might say like be grateful you had so far, or you had them so long. Then the worst thing is like to say, I know how you feel. Exactly, we don't know till we have a miscarriage or we lose somebody. We don't know exactly what feelings they are going through. So they might react like, no doctor, you don't know, because have you ever lost somebody? They may react like that. So it's very important not to use all these wrong things. Now let's see what are the nicer things to say. Like I always use like, my heart goes out to you. Do you have anyone to talk to? Have you got the support network? Then sometimes I might say like, grief is a normal, natural reaction to your loss. I will use my body language and tone. I will lower my tone and my facial reactions, everything, like I will tone down a bit. Then I would say like, you're not alone, particularly when patients are being diagnosed with cancers recently. I would always say like, you're not alone, we can go through this, you have got a support network here, we have got specialized nurse and we GPs here, we can go through this. I would say like that. Then if something which I can't imagine, then I will simply say like, really, I can't imagine how you feel now. I would admit that. That is very sincere response from us, isn't it? Rather than saying, I can understand how you feel. That's not appropriate. Then we can say like, what can I do to support you? Simple like that. So few things what we might say like, acknowledge the loss, acknowledge that whatever they are feeling is normal grief reaction, and sometimes just listening to them will make them feel better. We don't need to say anything dramatic. And then the second thing is, we don't need to try and fix it. We are just helping them to go through that difficult situation, difficult time. So just listening will allow them to heal themselves, and we have to encourage and give hope, and we have to care for them. So for all situations we can see the better future. Even we come across like palliative cancer patient, we still be very forthcoming and be supportive and encourage, and we have to give hope. Like there are so many options to keep you comfortable, to spend your time with your family and friend in a comfortable atmosphere. We can give lots of hope. Particularly as a GP, we do come across so many patients like this, like patients who has had recent miscarriage, or patients who have lost their dear ones recently, or patients who have been diagnosed with cancer recently. So there are so many variety of cases we will come across, and in CSA scenario it is one of the very difficult scene, because as doctors we'll have a list to cover. We might be thinking like, oh, I have to ask ideas, concerns, expectations, I have to ask about the psychosocial, blah 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 blah, but all those lists won't help us in this scenario. We have to be very sensitive, we have to be very empathetic, and we should be very careful about how we are using our voice, how we are using our body language, and we have to be very selective which words we are using. And it's very important to give some time, some pause, to allow them to grieve. Particularly when a patient said that she had been raped recently, it's very important to use the silence to allow her to express her grief, and then we can say something like, I'm really sorry. One of my colleagues said that he used like, I'm really sorry, I think I have brought back the difficult memories, something like that. Just pause and give enough time. Be a human, and don't think that they are simulators. Please think that they are the real patients, and we don't need to act. We have to be just like a human to another human, and that's what they are marking. So and we will do anyway like that in our real life, but with the exam tension and everything, with the 10 minutes, the timer going on, everything, we will panic. We all humans as well, isn't it? So try to practice as many scenarios as possible using this, and please practice all these sentences like, what can I do to support you, I can't imagine how you feel, do you have anyone to talk to, something like that. Just get practiced and be prepared, and then absolutely you will be fine. And good luck if you're having your exams in the next few weeks. And I have got whole scenarios called difficult communications made easy, ECOS. It's ECOS. You can go through those modules at the comfort of your own home. I talk about like difficult patients, angry patients, demanding patients, patients with unrealistic expectations. I go through all those scenarios, and I have given exact scripts, what to say, how to handle them, how to use our body language, and how to use magic words to bring them to the positive end. So these are all will help you to prepare for the difficult scenarios. If you think you need more support, please feel free to email to csasmartgroup@gmail.com. I'm more than happy to support and help you to prepare yourself. And that's all for today's Date with CSA. I will see you soon with some more CSA success tips. Bye-bye. Bye.
Thank you.